Hi, this is Joliet Mayor Bob Odekirk giving our weekly update about COVID. Once again, I want to thank city staff and our fire department, Deputy Chief Jeff Carey, for providing the numbers for our citizens to keep everyone updated what's happening here in Joliet. Unfortunately, we said this the last couple of weeks, since August, we are seeing the numbers locally continue to rise. Currently, we have about the same amount of people testing positive with COVID that we did back in May, which is unfortunate. So fortunately, the hospitals are not overrun. We're not in the type of crisis situation that we thought was coming back in May, but we are seeing a rise in levels, which is concerning. One of the things that we're concerned about locally is that if this continues to happen, that the governor and the state of Illinois are going to put restrictions on Joliet or on our region that we haven't seen since May or June when they were lifted. Recently, Region 4, which is downstate near St. Louis or East St. Louis, had the levels raised, which put restrictions on what local restaurants and local bars and local stores can do. So for the sake of our local economy, we're really urging people not to be complacent about this, to stay on top of it, to be mindful of the things we learned about social distancing and wearing your mask, and to try to keep a lid on this. We don't want to see anywhere in our city, or our state, but certainly not our city, slide backwards. We want to see us continue to move forward. So again, thank you, Deputy Chief Carey, and thank you for all that you're doing locally to help fight COVID-19. Have a good day.
Hello, this is Deputy Chief Jeff Carey with the Joliet Fire Department with your City of Joliet COVID update for August 21st. We get all of our COVID-related numbers from the Will County Health Department, the Illinois Department of Public Health, and the CDC. You can visit their websites for any additional information. There have been a total of 2,631 residents of Joliet who have tested positive for COVID-19, with 138 deaths since March. 373 of these positives are from Joliet nursing homes, as well as 79 of these deaths. We saw our COVID numbers peak in May and then stabilize June through mid-July. Since the beginning of August, our numbers have been steadily increasing. Our 2-week average is now at 351, which is similar to the numbers we saw in May. The hospital-related patient numbers for COVID cases have risen from their recent lows as well. There has been a slight increase from the beginning of the month, but the hospitals remain stable. Their nursing homes in Joliet remain stable as well. They have had a slight increase a couple weeks ago, but have not had any new cases since then. We are seeing an increase in overall cases. The Will County Health Department has reported seeing a very relaxed attitude when it comes to social distancing and wearing your mask. This attitude is problematic and will result in a sustained rise in cases if we do not change our behaviors now. We still do not know the long-term effects of COVID-19 after recovery. Continue to protect yourself and others by following the CDC guidelines. We need to act now to reverse this trend and keep everyone healthy. Efforts to reduce the spread of COVID-19, such as the stay-at-home order and shelter-in-place orders, have led to decreased use of routine preventative medical services, including immunizations. Ensuring that people continue or start getting routine vaccinations during the COVID-19 pandemic is essential for protecting people and communities from vaccine-preventable diseases and outbreaks, including the flu. Routine vaccination prevents illnesses that lead to unnecessary medical visits and hospitalizations, which further strain the healthcare system. Annual flu vaccination is recommended for everyone 6 months of age and older, with rare exceptions. While there are many different flu viruses, each season a flu vaccine protects against 3 or 4 viruses that research suggests will be the most common. Getting a flu vaccine will not protect against COVID-19. However, flu vaccination has many other important benefits. Flu vaccinations have been shown to reduce the risk of flu illness, hospitalization, and death. Getting a flu vaccine this fall will be more important than ever, not only to reduce your risk from the flu, but to help conserve potentially scarce health care resources. September and October are good times to get vaccinated. Persons at risk for increased serious influenza complications include infants and young children, children with neurological conditions, pregnant women, adults aged 65 and older, and other persons with underlying medical conditions. You can use vaccinefinder.org to find where flu vaccinations are available near you. When going to get a flu vaccine, be sure to practice everyday preventative measures. Thank you for being with us today. We will keep you updated as this pandemic moves along. And remember to wear your mask, social distance, and be safe. Thank you.